Good morning, everyone. Thank you so much for joining us on this beautiful Friday for our AOF budget review series. So we're going to review kind of the status of the budget that's currently in the Senate. We'll talk about timeline. We are starting to get into the final weeks here of the stretch. As you all know, the budget must be passed by both the House and Senate and reviewed and signed by the governor by the end of June 30th. So at this point, looks like we still have some time to make that deadline, but as we know, things always seem to get off the rails along this point. But we will go ahead and get started today, and we are also very lucky and excited to be joined by Gina Wilt from the Coalition on Homelessness and Housing in Ohio, as well as Will Petrick from Policy Matters Ohio to share a little bit more about their specific issue areas, housing, and then mental health and addiction as we move forward. But first, one more time, we're just going to give a brief overview of what's been happening these past few weeks over in the Senate. So this past week, subcommittee reports to the full Senate Finance Committee. They kind of talked about what they heard within their each issue area subcommittee. A few gave some recommendations, talked about some things that they're interested in, specifically within the Health and Health and Medicaid subcommittee. We heard some really, really good stuff coming from the leadership of that subcommittee, specifically, support for our increased ask for dollars for food banks, additional investments in adult protective services, increasing that publicly funded child care eligibility to 150%, and also making sure that we begin to more seriously address infant and maternal health, as well as issues concerning multi-system youth and preventing custody relinquishment for those parents. So while we heard a lot of great things coming out of those subcommittee reports, something that AOF specifically really wanted to highlight, and our friends at Policy Matters have been highlighting for the past few weeks, there was a report that came out of the Federal Bureau of Labor Statistics that showed last year 6 of 10 of Ohio's most common jobs paid wages that were so low that a family of 3 would need food assistance and other kind of public benefit systems in order to make ends meet. So this certainly means that, again, it's, if we take a second to think about that, the most common jobs in Ohio, 6 of 10 don't pay a living wage, and these families are forced to look to other means and to ask for help and look for assistance to really get by. And these are things that, we really want to highlight as AOF, saying that, we've heard really great economic reports lately that, the unemployment rate has been, hitting record lows for the past decade, but we want to focus that the needs is still out there, and that a lot of these jobs and this economic growth that's reported can really be attributed to really low wage jobs that don't support a family and don't even support an individual. So with AOF, again, highlighting that fact, we really wanted to follow through on the governor's commitment to make sure that we address those families and children specifically who have been left behind within this economic growth. So AOF did hold a press call this past week to kind of give the Senate and ask the Senate to, again, do more within this budget cycle to help, again, our vulnerable families, vulnerable children. Just wanted to highlight 3 of the main issues we discussed. So making the earned income tax credit refundable. We've highlighted this issue on a previous budget webinar series. Increasing the Ohio Works First benefit level. So this is the cash assistance. This comes from the Temporary Assistance for Needy Families Fund. This comes from federal money. The core purpose of this money is to help vulnerable families. And these amounts have not been increased since this program was first introduced in 1996. So it's time, these are dollars that could be used to buy diapers and personal hygiene products and shoes and clothes for children that other kind of benefit programs don't hit. So food and healthcare and such. So these are for school fees and other things that are really, really important for families to succeed when they have a high level of need. The last issue that we've really been talking about both through the House and Senate process is increasing investment in the SNAP or food stamps education and training program. As we've highlighted before, many able-bodied adults who receive food stamps are subject to work and education requirements for a certain number of hours per week in order to receive that food assistance. However, unfortunately, we've been talking with our partners at Ohio Legal Aid Societies and also talking to our partners at the county job and family services offices. And we know that those kind of EMT training programs, their availability and also their quality really, really varies across the state. And if we are going to implement these work requirements, we want to make sure that, again, Ohioans in every corner of the state have quality opportunities available to them, and that capacity exists for people to increase their skill set and earn, again, those hireable skills that are so important to really lift up and get that living wage job. Right now, there is a program at the federal government that will match 50% of state funds or county funds, or as long as they don't start as federal dollars, those funds that are invested in creating this programming for these SNAP recipients. So this is something Ohio currently is not taking advantage of. And we think it would be a great opportunity, again, to expand capacity and quality throughout the state of these programs if we build that infrastructure to draw down those federal dollars. So this is something we've been working with. This initiative actually was passed in the last budget cycle with funding to kind of start this infrastructure process. And the Senate cut the funding last year, and then there's actually some study groups and work groups in the code now that have not met to kind of talk about this program and really take advantage of it for the state of Ohio. So we're simply asking, and we've had interest, bipartisan interest in both the House and Senate have introduced this amendment for us, this program, and we're hoping that we can move forward and then it gains some traction here in the Senate. So what's next? So looking on the timeline of the next few weeks, again, fast and furious over in the Senate. So next week, starting on Tuesday, we'll continue with full Finance Committee hearings. I know on Tuesday, kind of the Health and Human Service, Medicaid, and JFS subjects will be heard. So that will be a long day. So AOF, I know, is planning to testify along with a number of our partners. Also, by the end of that week, we expect to see that first round of amendments, that first round of changes that the Senate wants to make to the bill. Their amendment deadline was this past Wednesday. So we know that members of leadership in the Senate are convening this weekend to go through amendments and make their plans and see what they want to keep or pull out of that budget bill. I know, in kind of a long day tomorrow is their plan. So we're hoping again by next week, by the end of next week, we'll see the results of those changes. The following week, they will ask for a second round of changes in the Senate. This is called the Omnibus Amendment. It's a big chunk. Usually we see a long list of bullet points of changes that we want to see. There's usually not much time between seeing that Omnibus Amendment, that second round of changes, before the full committee votes or the full Finance Committee votes, and then usually the next day or within the next day or two, the full Senate votes on that budget. So again, we are coming to the end of the legislative process, essentially in the Senate. So after the full Senate votes, we do have that conference committee process. They've given themselves about a week and a half, 2 weeks, to deliberate between the House and the Senate on and concur between the differences between those bills. So that's always an interesting time. And also something I want to highlight, usually we can see brand new things introduced during conference committee. So we always keep our ear out to the ground to see kind of what policies they're thinking about, what's gaining some traction with leadership. But then the plan, again, is to have that conference committee vote. And also just a reminder, there is no opportunity for legislative testimony or public testimony on that conference report that comes out. So right, everybody. So we lost the the slideshow. My apologies. We're going to get it back up in just a second. But within that conference, or this next week, is the last chance for us to comment on that budget. Excuse me for just a second while we get this slideshow back up. All right, fantastic. We're back online. So we will go ahead and move forward. Again, we will entertain any questions about process, kind of how we're going to move forward here at the end. But for now, again, we are very lucky and excited to have Gina Wilt from the Coalition on Homelessness and Housing in Ohio join us this morning. Gina, thanks again for being with us and letting us know and all about housing in Ohio. So take it away.
Thank you, Kelsey, and I really appreciate the opportunity to give some information out on our kind of world right now in the housing department. So I think you did kind of talk about this somewhat. You know, we're actually really happy that the well-being of Ohio's children has been a huge focus of the administration and really of the legislature as well. But of course, we know that if you put housing first and really focus on housing and making sure that every child has a safe place to place their head at night, then all the other work that we do is going to be way more effective. And so we're really trying to get housing out of like the back burner position and put it up front and make it a priority. So we had an ask, and I guess, I don't know if you're going through the slides. So of course, the Ohio's housing needs is a good place to start. You can see on the slide we have 400,000 households that spend over half their income on rent. And I know a lot of you have heard this statistic before too. Of the 10 most common jobs in Ohio, only 2 actually pay enough for a 2-bedroom apartment. And we had over 70,000 Ohioans access homeless services in 2017. We've seen a huge rise in family homelessness, which is not just a trend here in Ohio. That is a national trend. But, you know, I truly believe that Ohio is better than 3,000 homeless babies entering the system. I know we can do better. And that population has grown by 53% in the last 5 years. So, you know, when we have, you know, when you're talking about nearly the 400,000 Ohio households that spend over half their income in rent, it really doesn't leave any room for error. So if they get pregnant, if they lose a job, have some type of medical complication, they're knocking on that door to homelessness. And unfortunately, they're running into situations where they're on a wait list and wait list for any type of safe and affordable housing. So the need is great. And the only resource for housing, going to the next slide, the only resource is the Ohio Housing Trust Fund. That's the state resource. That's the only state resource that we have. In the trust fund has kind of 3 different buckets. So the homeless services, shelters, supportive housing, you know, kind of the front line coordinated entry for anyone who is entering the homeless system. It also funds home repair to help our seniors or individuals who have disabilities or become disabled and they need a ramp, or they need some type of modification to keep them at home, which certainly saves dollars if they are able to stay at home. We want to keep them at home where they are safe and secure and where they like to be. And then the third big part of the trust fund, of course, is development. So construction and preservation of affordable housing. And so the Housing Trust Fund, going to the next slide, we have increasing need and then the decreasing revenue. So we've had, in years past, we've had a lot more coming into the county recordation fees, which is how we're funded. We do not get any GRF. So the Ohio Housing Trust Fund is funded by county recorder fees, so maybe if you buy a house, you might go to the county recorder and get your mortgage recorded, or maybe you change your name. Lots of things you would go, maybe you're putting a fence up in your yard, you go get that recorded at the county recorder's office. So for every page, there's a price. So right now, when you go to the county recorder's office, the first 2 pages combined is $28. Each page after that is $8. And that's how we're funded. So like Bill Faith likes to say, it's so archaic, and there's like monks counting in the back room pages. And it is, but it's how we're funded, and that was set up by the legislature through a couple different task force back in 2003. So we're only funded by the county recorder fees that come in. They come in and then they go back to the state, and then it's a statewide program. So those dollars, as you can see, they're not coming in like they used to. So as need for housing resources have gone up, the fee is going down. And, you know, of course, there was a recession, and you can see that the fee went way down in fiscal year 09. And then in fiscal year 13, there was a little bump, not 100% sure why there was a bump, that maybe things are starting to get better. Some people think it was the fracking, but then it went back down again. So, and we've just never gotten back up to where we used to be, which is why we're asking for an increase. I guess I'm trying to, so the trust fund expansion, the next slide, we've had lots of different ideas on how to address this, and some of our champions last General Assembly, Kirk Schuring and Ryan Smith, and the county recorders actually worked with us, and we put together a plan that would not have us counting pages. So instead of counting pages, we would just go to a flat fee. We would increase the fee and then just make it flat, so there'd be more predictability, and it would kind of take into account the new technology, things going digital, as well as the fact that like mortgages, for instance, people are doing like master mortgage documentation. So instead of maybe a 13-page document, they're shrinking it down to just a few pages. So of course, you know, that's less dollars for us when all of those documents are being shrunk down. So we thought, let's go to a flat fee so we can have predictability. And then we've also talked about just increasing the per page fee. And then again, just maybe getting GRF in addition to the current structure, adding a GRF appropriation. So where we're at right now, the House did not include any of our amendments in their version, even though we had some great champions and I think we had some good interest. I think the time was cut short. There's lots of aerials probably to why we did not get in. So we're focused on the Senate now, of course. We did end up testifying yesterday, and we're asking for a very simple per page fee increase. The feedback that we got in the House and feedback that we've gotten in the Senate is that we needed a less ambitious proposal, that, you know, we were with going with a flat fee that was kind of shaking things up maybe too much. And so we have a very modest approach. This is more of a Band-Aid. Doesn't really get us back to where we need to be, but it at least brings us up to a more reasonable and respectable housing trust fund amount. And so we're focused now on a per page fee increase. So right now, again, it's $28 for the first 2 pages, $8 for each page after. So we're asking for $32 for the first page and then $8 thereafter, which would generate, hopefully, of course we don't know because it depends how many people record documents, etc., but we're hoping it would generate around $8 million for the trust fund each year, closer to 16 over the biennium. So we're hoping this is a very simple, small, teeny tiny ask. Doesn't cost them anything because it's not GRF. And again, the county recording fee has not been increased since 2003. And that was when we were added. So, and before that, the county recorders, they haven't seen an increase since 1993. So they haven't seen an increase since 1993. In 2003, when the trust fund was added, that was an increase to them, but they didn't see any of that increase. That was our part. County recorders haven't seen, that local government entity has not seen an increase since 1993, and the trust fund has not seen an increase since 2003. So it's definitely time, not to mention inflation and buying power. Nate Clausen with the Ohio CDC Association, he likes to talk about the declining revenues combined with accounting for the consumer price index. The Ohio Housing Trust Fund's purchasing power has decreased 60% since the fee was created. So economically speaking, it's definitely low. And another kind of economic point that we like to make is that each development dollar that the trust fund invests leverages more than $8 in private and federal matching funds, and also generates close to $12 in overall economic activity for the state. So we think it's a good investment. The next slide is just some little bit of background about our advocacy campaign, Home Matters to Ohio. Some of our main organizers, and this list right here is like our steering committee, who have been fantastic, and their relationships with members of the General Assembly, and really just providing the actual day-to-day needs that are out there. So, so we just testified yesterday. We have scaled back our ask. We've listened to the feedback that they gave us, not to be so audacious. So we've come in with a very modest ask, but we really feel like the legislature, they just can't say no. We have to get us, we actually have a tool. The Housing Trust Fund is a great tool to solve a lot of problems. If it's funded the way it should be, then we can really solve problems like nearly 3,000 homeless babies entering the homeless system last year, and the huge spike in family homelessness. So we're asking folks to reach out to their legislators and just ask them to support the Housing Trust Fund. We do think the proposal that's out there right now is a win-win solution, because the local governments, so the county recorders, they'll get more and we get more. So both sides get a little bit more, and we're able to put it right back into the local delivery services and programs, so that know what the community needs in each area of the state. So thanks for letting me share.
Well, Gina, thank you so much for being with us today. So we did have a question from one of our folks on the webinar today. The question is, do county recorders now offer online services? And if so, can the Ohio Housing Trust Fund, or looks like interested partners like your organization, receive income based on this online access?
That's a great question, and I don't think I have a good answer, but I can certainly go back and find out, and I might maybe I can talk to you too to get maybe a more clear question too, that I can figure out the best way to answer it.
Nope, that's fantastic, Gina. We will circle back, and we do have
certainly
that person's
as technology. Yes, thank you. Yeah, certainly as technology changes, this per-page counting mechanism is not. I don't see it going on much longer, but who knows? I thought we would stop faxing by now, and we still fax. I don't know.
Right. Looks like one day, again, maybe this would look like something that's possible in the future, but at the moment, it's mostly still faxing. Very interesting. All right. Well, thanks again, Gina. If you wouldn't mind sticking around on the line for questions at the end, we will go ahead and move along. Will, are you with us?
I think so. Can you hear me?
We can. Fantastic. Well, Will, thanks again for joining us today. So Will is here from Policy Matters Ohio, and he's going to talk about some of the major initiatives in mental health and addiction services within the proposed budget. And we are also happy to have Kelly Smith from the Mental Health and Addiction Advocacy Coalition on the line as well. So she's going to hop in, especially to help us some questions and some of the deeper details about what's going on in this space. But again, Will, we are so happy to have you, and feel free to take it away.
Thanks, Kelsey, and thanks, Gina, for all the information about affordable housing, and for Kelly for joining as well. So again, my name is Will Petrick. I'm the budget researcher with Policy Matters Ohio. We're a nonprofit, nonpartisan organization, and our mission is to create a more vibrant, equitable, sustainable, and inclusive Ohio. So today, just want to jump in and talk about the challenge that we face in the state of Ohio. So there's several interconnected public health challenges, including drug addiction, trauma, mental illness, and depression. And we know that when people struggling with these issues get treatment, they can recover and live healthy, productive lives. And so that's, the ultimate goal. We want to build stronger communities. We want to support people who are struggling with these issues. When folks don't get the treatment they need, it can literally cost them their life. So as you can see from the slide, over 4,800 people died from drug overdose deaths in 2017. That same year, Ohio ranked second worst in the nation for overdose deaths per capita. A more recent count from the CDC showed that Ohio has actually seen a 21% drop in fatal overdoses. So this does indicate some progress, but there's still a really long way to go to get the epidemic under control. One of the things that we've heard from testimony over the last several weeks is just reports from across the state that while the opioid crisis may be peaking, we're hearing reports that meth and cocaine deaths are now on the rise. So that's another major concern across Ohio. Also in 2017, we lost over 1,700 people to suicide. The other thing I wanted to note was currently Ohio treats too many people who are in a crisis, so that might be a suicide crisis or an overdose crisis, by sending them to the emergency room or to jail. And these options are often traumatic for the person experiencing the crisis, and it's also super costly for taxpayers. Those are not the most cost-effective solutions. So there's a lot more work that's needed to save lives, to improve wellness and recovery services, and build those local systems that can respond to those crises more efficiently and effectively. So you can go on to the next slide. Wanted to share a little bit just about the last several years and how we've, as a state, have responded. So I think one of the big things in 2013, as many of you I'm sure know, Ohio lawmakers approved federal funding to expand Medicaid, and this has been really essential in providing services to hundreds of thousands of Ohioans who struggle with mental illness and addiction. Medicaid now provides coverage to nearly 3 million Ohioans. Also wanted to note that just in the last state budget, lawmakers did increase support for mental health, addiction services, public health, and recovery housing, all with the aim of stemming Ohio's rising drug epidemic. You can go to the next slide. Another response, so just at the beginning of this year, after being inaugurated, Governor DeWine created the Recovery Ohio Advisory Council to better assist those who are struggling to recover and help them lead high-quality, productive lives. So that task force worked very quickly. They developed 75 different recommendations, again, all with the goal of strengthening prevention, treatment, and recovery systems in Ohio. And several members of Advocates for Ohio's Future were actually a part of that advisory council and helped to shape the recommendations. And we were really pleased to see several of those budget and policy priorities included in the proposed state budget for 19 and 20. You can move on to that piece. So in the two-year budget submitted by Governor DeWine and passed by the House, there was a boost of support for the Department of Mental Health and Addiction Services by just over $259 million. And that budget increased funding to psychiatric hospitals. It also included an additional $22 million for the local Adam H. boards that work to meet those local behavioral health needs. It also includes an additional $12 million for an expansion of Ohio Start to 30 additional counties. There was money included to reduce the stigma associated with mental health and addiction. So there's $8 million to support multimedia public awareness campaigns around reducing the stigma. We also saw some increased support to strengthen the workforce in behavioral health. So there was a little over $15 million to support recruitment, training, and retention, and also to improve licensing and certification. There was also significant support, $37 million, to improve that crisis stabilization network that I had mentioned, and really provide more resources for those who need that immediate crisis support. So you can go to the next slide. So we also saw some additional support for recovery services in the Ohio Department of Education and the Ohio Department of Medicaid. So in education, in the governor's budget, he included $550 million for student wellness and success, and actually the House passed budget, the House added an additional $125 million for that purpose. Those resources are intended to improve students' social and emotional skills so that they can make healthy decisions. And you know, if approved, that the dollars will support mental health counseling, wraparound services, trauma-informed care, mentoring, and after-school programming. And again, that's all kind of geared towards supporting our K through 12 students. In the Department of Medicaid, the major thing was that the budget does maintain Medicaid expansion, which I think I mentioned it's Ohio's strongest tool to treat people caught up in the drug epidemic. And the budget also devotes some additional resources over the biennium toward recovery-related initiatives. I think the next slide has more details on that. So I won't go into all of them in detail, but some of the high points, again, it was $511 million, and that's in all funds. That's in state and federal funds towards these recovery initiatives in the Medicaid budget. So $47 million for home visiting, $15.6 million to support mother and baby care for women with an opioid use disorder. There's $15 million to expand telehealth services, $20 million to establish services for multi-system youth. That's the youth involved in multiple systems, so you know, if they're involved in juvenile justice and child welfare and behavioral health. Another significant investment was the $338 million for behavioral health care coordination, and those resources will be used to develop a model to really coordinate behavioral health care to serve Ohioans with the most complex and urgent mental health needs and substance use disorders. So as advocates for Ohio's future and policy matters, we support all of these investments. Also just wanted to share a brief update, and also, if you weren't familiar with parity, share a little bit more about what it is and why it's important. So the Mental Health Parity and Addiction Equity Act was signed into law over 10 years ago, and it established what's called parity. And that means health insurance plans are required to cover behavioral health care services equally to physical health care services. Unfortunately, parity is not a reality for so many Ohioans who do live with mental health challenges or substance use disorders. As you can see on the slide, our state scored an F in a parity report by the Kennedy Satcher Center for Mental Health Equity. So how can we ensure parity compliance? There's several things we can do. One, it's really about education. So we need to educate patients and hospital staff and social workers, public health workers, so that everyone understands their insurance coverage rights. And Advocates for Ohio's Future supports the Ohio Department of Insurance request for $2 million over the biennium to ensure parity compliance, to help educate and assist consumers to understand their right to mental health care and behavioral health care. So to close, I wasn't on the call at the very beginning, but I just want to reiterate Advocates for Ohio's future budget and policy priorities to create a healthier Ohio, and specifically as they relate to recovery services. So first, I want to continue to ensure that state lawmakers fully fund and preserve the Medicaid expansion as it exists today. Second, we are asking the Senate to maintain the investments I outlined for mental health and addiction services. The resources included in the governor's proposed budget and expanded by the House do take some important steps to respond to the addiction and mental health public health care crisis that's in our state. So we look forward to continue working with Advocates for Ohio's Future, with policymakers, with folks on the phone to help continue to advance the recommendations in the Recovery Ohio report and to continue to make investments to see a healthier Ohio. And with that, thanks all for listening. The end of my slides. Thanks again to Kelsey for including us on this webinar.
Of course. Well, and I really appreciate it. Again, this issue certainly is complex and has had a lot of change within the last budget cycle, last two budget cycles. This, with the issues facing Ohio, I know that these investments are incredibly important. And thank you so much for walking us through it this morning. So once again, we are here to entertain any questions you have. If we don't have the answers, we certainly know who does here on the phone. And again, want to thank Gina and Kelly and Will for taking time out of their pre-holiday Friday morning for joining us today. So next time when you see our budget webinar coming up in 2 weeks, so that will be June 6th, I believe. So by that time, we will have seen what the Senate proposes, what they want to see in the state budget moving forward. So we'll have a pretty intensive update on what changes they want to make. So we'll so stay tuned for more information in the future. Once again, we'll stay on the line for a couple minutes here to see if we get any questions. And once again, feel free to contact me. My email's in the beginning of the slide or in the slides. You'll receive a PDF version of these within the next few minutes. And as always, we post the slides as well as a full recording of these webinars on our website. So you'll receive links to those as well by the early afternoon. So thanks again, everyone. Please have a happy and safe Memorial Day weekend and enjoy.
Thanks, everyone.
Thanks, Kelsey. Thanks, Will.
Yeah. Gina.
Thank you.
Kelly.
All right, everybody, we are going to sign off here. Once again, feel free to contact us with any questions in the meantime. Have a great weekend.